Welcome to the Joy Fit and Focus channel. This channel is all about everything life and living. Today, we are looking at a critical issue that affects millions of people worldwide: overmedication. We'll look at the risks, consequences, and what you can do to protect yourself. Overmedication is a growing concern. With pills everywhere, millions of people are taking unnecessary or excessive medications, leading to serious health consequences. The risks are real. Let's dive deeper into the problem and explore solutions. Medicine and drug are two words often used interchangeably. Medicines are substances used to prevent, diagnose, or treat diseases or medical conditions. The World Health Organization, WHO, defines a drug as any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. Hence, a drug is any substance that affects the body's physiology or psychology which can be used to treat medical conditions or for recreational purposes. Drug is a broader term that covers a wide range of substances, including prescription medications, OTC medications, and illicit substances like narcotics or stimulants. Therefore, all medicines are drugs, but not all drugs are medicines. Our discussion today will be referring to both medicines which are therapeutic and non-therapeutic drugs. We will start with a critical question. Do you really need that medicine or drug? What is overmedication? Overmedication simply means that you are taking medications that are not needed. It is when someone takes more medication than they need, either by taking too much of a single medication or by taking multiple medications that may be harmful to them. There is a current global challenge where people are more dependent on medication than they are on good nutrition. Also, individuals are not choosing lifestyle improvement options which can reduce the need for medication. As a key part of this discussion, we will amplify the first part of Hippocrates' quote that says, "Let food be thy medicine." Another critical advice for health and wellness is in the Ayurvedic proverb, "When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need." Good diet and good lifestyle practices have been proven over time to positively influence health and drastically reduce, or at times eliminate, the need for medication. Overmedication can happen in different ways. Examples include taking medicine or drugs even though they are not required, or taking medication when they are no longer required. Taking medications based on suspicions of illness or disease without first confirming the need. Self-prescription or using a lot of over-the-counter medicines or drugs. Incorrect diagnosis of the patient's medical condition. Prescription of inappropriate drug or incorrect dosage of the appropriate drug. Patient not following the instructions for taking medication correctly. Health professionals' secrecy when they do not disclose name of drugs given, sometimes in an effort to prevent the person from buying such drugs by themselves. The affected individual may be taking related drugs or drugs with same active components, thus increasing the dosage without knowing. Commercialization of patients' health. Health professionals recommending medicines or treatment to aid marketing and sales of preferred brands, given, sometimes in an effort to Sometimes, it may also be due to miscommunication between healthcare providers or pharmacists. Other times, it is because patients don't understand their medication regimens. Risks and consequences. The consequences of overmedication are staggering. Overmedication risks and consequences include addiction, adverse medicine or drug reactions, allergic reactions, medicine interactions with other medications or foods, mental health issues, decreased quality of life, and physical health problems. Constantly remember that all drugs have side effect. There is no drug without side effect. This have been confirmed and stated by the World Health Organization, WHO. Drug side effects vary from minor problems to life-threatening events, such as organ damage. For instance, the widely used paracetamol, acetaminophen, that is generally considered safe when properly used, have potential side effects such as nausea and vomiting, allergic reactions, liver damage at high doses or prolonged use, abdominal pain, headaches, dizziness or drowsiness, skin reactions, fatigue, confusion, jaundice. Blood disorders like low platelet count or low white blood cell count, interactions with some drugs in combined medication. Drug side effects are classified as 1. Type A side effects are dose-dependent. The adverse effects can at either normal dose or overdose depending on the individual. The higher the dose or quantity the drug taken, the more the risk of negative side effect. Examples include hypotension from antihypertensive medications and bleeding from anticoagulants usage. 2. Type B side effects. These are strange, rare, unpredictable, and not related to the drug's pharmacology. Risk of side effect may vary depending on individual differences and circumstances surrounding the medication. Allergic reactions are examples of such side effects. 3. Type C side effects are described as chronic, time-related reactions that may occur with long-term use of the drug. A good example is osteoporosis from long-term steroid use. 4. Type D, known as delayed side effects, occur after a delay, often after the drug has been discontinued. Examples are carcinogenic effects, e.g., cancer, teratogenic effects, e.g., birth defects. 5. There is also the type E, end-of-use, side effects. These occur when a medication is stopped. Withdrawal symptoms from antidepressant discontinuation syndrome is an example. 6. Then the type F, therapy failure, side effects. They occur when a medication doesn't work as intended, as in the case of lack of drug efficacy or antibiotics resistance. In addition, drug interactions can occur when a medication interacts with another medication, food, or substance, leading to adverse effects. There are also organ-specific side effects such as hepatotoxicity, liver damage, nephrotoxicity, kidney damage, cardiotoxicity, heart damage. Drug side effect risks are usually weighed against the benefits before usage. Avoid taking any medicine or drug without researching its function, possible side effects and complications, and interaction with other drugs and foods, even if recommended by a physician or health professional. In a narrated real-life experience, a patient consulted for cough and a feeling of being unwell. An antibiotic was prescribed with vitamin C, pain reliever, and malaria drug. After taking the medications for 5 days, the cough, which was the main complaint, did not subside. Instead, the coughing was getting worse. She researched the prescribed antibiotics online and discovered that cough was one of the side effects of that particular antibiotic. A pharmacist then recommended another antibiotic. The cough subsided within 2 days of taking the second recommended antibiotic. Note that some other patient may not have the same negative experience if treated with first prescribed antibiotic. Individuals differ in reaction to some drugs and their side effects, but it is always good to be well informed. According to World Health Organization, unintended, harmful reactions to medicines are among the leading causes of death in many countries. Who is at risk for overmedication? The answer is, anyone can be at risk. Additionally, older adults, children, and people who take multiple medications or multiple prescriptions are at risk of negative effects due to too much drug intake. Watch out for some commonly overused and overmedicated drugs, even as prescribed drugs. Some examples are 1. Painkillers overuse leading to addiction, overdose, and sometimes death. 2. Antibiotics overprescribed for conditions like sore throats, which are often viral and health conditions that don't respond to antibiotics. 3. Sedative medications can be habit-forming and increase the risk of dependence. 4. Psychiatric drugs, antidepressants, which are commonly overprescribed and may lead to dependence and increased risk of suicidal thoughts. 5. Stimulants overprescription and overuse can result in abuse and dependence. 6. Proton pump inhibitors, PPIs, prescribed for acid reflux can be overused, leading to potential side effects like osteoporosis and increased risk of infections. 7. Hormone replacement medications may be overprescribed, especially if patients don't require them long-term. 8. Anticholinergics used to treat conditions like Parkinson's disease and COPD can cause dizziness, fatigue, and cognitive changes, especially in older adults. 9. Dextromethorphan, found in cough medicines, can be abused for its psychoactive effects, leading to dependence and increased risk of addiction. 10. Diphenhydramine, an antihistamine that can cause euphoria, hallucinations, or psychosis when overused. 11. Pseudoephedrine can be abused for weight loss or athletic performance enhancement, leading to insomnia, dependence, and psychotic behavior. 12. Benzodiazepines. Medications like alprazolam and diazepam can be addictive and lead to dependence. There are still many others. How to prevent overmedication. Prevention is better than cure. It is crucial to always pay attention to your diet. Consult a qualified and experienced nutritionist or dietitian when necessary. Eat nutritious food that is good for your body at the right time, in the right quantity. Be well informed about things that can affect your health negatively or positively. Your body or system does not accept ignorance as an excuse. Regularly assess the need for any medication. Exercise and be active to the extent that your body and health need. Focus more and put efforts on things that affect your health and wellness positively. Take care of your health and well-being. Carefully review every medication with your health professionals. Understand each medication, including the name, dosage, and potential side effects of each medication before taking it, whether it is prescribed or over-the-counter, OTC. Consider alternative treatments for any health challenge. Monitor your body reaction to any drug and diets that you are taking. Every individual is a different person, and individuals may react to medications and certain foods differently. Remember the God factor. The information and wisdom for healthy living comes most times from God if you pay attention. Be happy, be joyful. Joy, happiness, merriment are effective health enhancers that impact positively on physical health, mental health, emotional health, and longevity. This will reduce dependence on drugs or completely eliminate your need for medication. Keep on creating your happy moments. Thank you for watching. Overmedication is a serious issue worldwide, but by being informed and proactive, you can protect yourself and your loved ones. Remember that your health is in your hands. Your wellness is your responsibility. Stay informed, ask questions, and advocate for yourself. Remember this crucial question to always ask and answer. Do you really need that drug? If the answer is yes, take it. If the answer is no, do not take it. What you take today may affect you tomorrow or in future. If you like this video, please subscribe to this channel and share this video to someone who need to see it. You can follow this YouTube channel and also follow me on Facebook.